Welcome to Delray Medical Center's Virtual Speakers Bureau. We appreciate you joining us today. I am delighted to introduce Dr. Steve Cohen. He is a cardiologist here in Delray Beach, and he is on the medical staff of Delray Medical Center. He's going to talk to you today about how COVID-19 affects the heart. And at this time, I'll go ahead and introduce Dr. Cohen.
Hi, good afternoon, everybody. Thank you all for meeting in this unusual manner, which unfortunately we are left with instead of our live meetings that we have a few times a year. I've been asked to give a talk about something current, and I don't think there's anything more current today than talking about COVID-19. So with the latest information, I'm going to try to provide you primarily its effect on the cardiovascular system, which is what I'm most involved with. I'm going to try to avoid some of the other organ systems that may fail, but we'll have to touch on it because sometimes they're related. First, let me introduce myself for those who don't know me. I've been in this area for 29 years. My primary specialty in cardiology is preventive cardiology. I did my training both in New Jersey at Seton Hall and the University of Pittsburgh, for which I've been down here since. So first, let's just talk about COVID-19 and its impact on the healthcare system and where you, the patient, is getting their information from. Unfortunately, not all the information you're getting is accurate. That's because of multiple reasons. The news, no matter what your favorite news source is not always accurate because a lot of the news sources have an agenda, either for precaution reasons, one to make you more worried or less worried for whatever their source is. Certainly not going to get the information from the news. You're not going to get it from your politicians. And the CDC, even in their best efforts, sometimes they're wrong because a lot of things that were said early by the CDC with the virus is not true today because we have new evidence that's coming out almost daily. So then you have the mixture of the people that are trying to improve the economy at the same time they're fighting the virus. So we really don't have a uniform, real thought process of how the best way to go forth from this point. All I can tell you, it's a combination of all the above. And you have to look at everything with really a very critical eye before you come up with your assumptions of how you should be behaving during this epidemic. Another thing to point out is a lot of you turn on the TV and you see all the massive amount of deaths that are occurring due to COVID-19. Some of them are true deaths, true COVID-19 deaths, but there are a lot of times they're not really true COVID-19 deaths. And we're not going to know this for months and months, what it was truly due to COVID-19 and due to other problems. An example of this would be the patient that has, for example, going to the hospital for a hip replacement. So for whatever reason, they develop some kind of minor complication and they may have some respiratory compromise. So part of the workup may be to test them for COVID-19 at that point, and they may turn out positive. Let's say that minor complication turns out to a major complication, and unfortunately the patient dies. So that death is going to be listed as a COVID-19 death, but truly it's not a COVID-19 death. It's a death to other medical causes, and the patient incidentally had COVID-19. So the true death rate is really, truly unknown, and truly sometimes very serious and sometimes maybe not. With that in mind, now we're going to move on to the cardiovascular system. So what are some of the symptoms that patients that present with some of the cardiovascular manifestations of COVID-19? Well, the most common one you would think about would be shortness of breath, racing of the heart, generalized fatigue, which could be related to lots of things. There's two complications, two symptomatology pathways that have caused the problem in the cardiovascular system. The first one is the most simple one, an indirect way. Indirectly, how is the cardiovascular system affected? Well, patients often, because of fear of going to their doctor or going to the hospital, often at home develop cardiac symptoms and actually could die from them because they never got it adequately checked out. Unfortunately, this is a true serious issue. And I've seen it even in our own practice that patients who've had cardiac symptoms because of that fear did not go to the doctor. So obviously COVID-19 affected their heart in a very indirect manner. Let's talk about the direct effects. Well, any infectious process is going to increase someone's blood pressure or heart rate. Sometimes the infectious process on the more serious end could actually lower their blood pressure. It could be something with an exacerbation of a chronic problem the patient may have. For example, they may have an arrhythmia problem, which they have already, or an irregular heartbeat, which the virus, because of the various mechanisms, the way it affects the body, may cause that problem to significantly get worse. They'll have effects on their coronary artery disease, which I'm going to talk about shortly towards the terminal phase of the virus infection. And finally, it could exacerbate diseases like congestive heart failure. So in summary, it affects heart rate, blood pressure, arrhythmias, coronary disease, and congestive heart failure. There's something relatively common, unfortunately, that the disease can cause, which is not present a lot frequently with other viruses. It is, but it's not as common as we've been seeing. And that's a disorder, which I'll describe shortly, called myocarditis, where the actual muscle of the heart, because of the virus and inflammation, is affected and causes symptoms such as fatigue and shortness of breath. And finally, there's a disease entity called Takotsubo's cardiomyopathy. This is the disease where any stressful situation, whether it's emotional or physical, can cause the heart to temporarily stop functioning normally and develop heart failure. This is true for a lot of viruses, but we've also noticed it as well in this modern COVID-19 virus. So now let's talk about how the virus infects the body and how it specifically infects the heart in what phases. So generally, for simplicity's sake, there are 3 phases for which this mechanism works. Phase number 1 is the upper respiratory infection. This is the phase that affects lots of people that are COVID positive. As a matter of fact, 40%, that's 40% of patients who develop this phase are often asymptomatic. They may have a minimal cold. Often we hear this story mainly with young people who tend to be carriers who don't feel it other than having a minor cold. So that's 40% of all patients. The virus ends here. They've developed a mild episode or an asymptomatic episode. And that's phase 1. Phase 2 is more clinically relevant. Phase 2 is when the patient seeks medical attention. They have some type of imaging procedure, such as a chest X-ray or a CAT scan or an MRI, and it's markedly abnormal. There's definitely a change in the lungs. This is associated with a low oxygen concentration, also called hypoxia, and this would be stage 2. Patients in this stage can often get better with or without treatment, and often don't even need to be in the hospital for treatment. The problem is the patients that progress to stage 3. This is the real problem. This is called the inflammatory stage, where the patient is set up for multiple organ failures. Here we're going to talk specifically about the heart. What are the inflammatory changes that occur to patients in this stage? Well, inflammation in the body often causes an increased heart rate. The increased heart rate, as I described earlier, can cause what we call arrhythmias, can cause diseases called atrial fibrillation, for those that are aware of that, an irregular heartbeat, or extra heartbeats on the bottom part of the heart called ventricular tachycardia or ventricular arrhythmias. It can cause high blood pressure during the stressful component. And when patients are really, really sick, their blood pressure can get exceedingly low, and it can cause hypotension or low blood pressure, which require often multiple drugs in an ICU setting just to maintain the patient's life support system. Because of the heart rate and the inflammation, it can cause the weakened heart muscle. I described earlier the various mechanisms for which the heart muscle is affected, whether it's inflammation or a direct result of beating very quickly for long periods of time. So this is what the patient feels. So how does the doctor or the hospital assess these type of things? Well, simple things. We take blood pressures, we measure oxygen saturation, and there are often lab tests that we often do, which are very specific to the heart, where we as cardiologists get involved. They are tests, for example, called troponin or BNP. We call these things biomarkers. They basically measure the effect of the virus or any disease state on the heart muscle itself. Sometimes they affect the lining of the heart. The heart is lined by something called the pericardium, and often this can get inflamed and cause diseases like pericarditis. And finally, what we're often seeing now in the acute phase, and now I'll talk about shortly in the chronic phase, is something called myocarditis. Once again, it's inflammation of the heart muscle, which may be temporary and unfortunately sometimes permanent. So how does one determine this and the severity? Well, the first thing we talked about is the blood levels. It's these laboratory tests. What we're finding in people that are really sick is that these blood levels of troponin and BNP stay elevated. In other words, the patient may start to feel better from a lung standpoint, but these blood levels remain high. That we found is really a poor prognostic sign, which means that their inflammation in the heart is not going away. As a matter of fact, a recent study showed that 78% of patients that reach this stage still have inflammatory markers still present in the heart. This is defined by blood work, and also there's another imaging test we do called an MRI, which could look for signals to signify chronic inflammation in the heart. So between blood tests and imaging tests, we now know even if patients completely recover from the virus from this third stage, they still may have markers that show heart involvement. What this will mean from a year from now, I don't know. But I personally, have seen patients in our office who have recovered completely from the third stage, but they still have signs and symptoms suggestive of a long-term process called myocarditis and need to be treated for this, and the time period is unknown. Now we're going to move on to some of the worst prognostic signs. During this third stage, which we talked about, also remember this is also called the inflammatory stage. There are multiple other things that are going on in the body. The patient develops what we call a thrombogenic state. Thrombogenic means blood clots. In other words, their clotting disorder, the patients are becoming more prone to cause blood clots. And these blood clots can be in multiple organs. This is a very poor prognostic sign. Often this leads to the true death of a COVID-19 patient. Where do these blood clots form? Well, obviously they form in the heart, and they can cause problems such as heart attacks, or could exacerbate a prior problem where the patient may develop chest pain and angina. They can develop in their legs and cause disorders called deep vein thrombosis or blood clots there. The blood clots in the leg may propagate or move towards the lung and cause things like pulmonary embolism or blood clots there, which are often quite difficult to treat and are lethal alone, let alone having the virus on top of it. Finally, they could even affect the brain and cause blood clots there, and that leads to a stroke. So the issue is getting to this stage is an extremely poor prognostic sign, and often all the medications that you've even read about or heard about at this stage often don't work well because the patient is very, very sick. We do know now, as of a few weeks ago, that blood thinners that are started when patients start to develop symptoms and signs and they're progressing towards this stage are quite helpful. So they may prevent some of these manifestations that I've described. There are actually active research looking if maybe the blood thinners should be started earlier to even prevent this further down the line. How long does this last? Well, you and I know that some of these patients remain in the hospital for weeks, if not months, and have persistent problems. Some people recover. Whether you recover or not, there's no magic rule, but we do know that patients that have more medical problems have less of a chance of recovering and often reach this stage. There's always exceptions to the rule. You're always going to hear about a 90-plus-year-old patient who has 16 medical problems who recovered fine. And you're always going to hear about the young person, the rare young person that actually gets really sick from this and doesn't recover. So there's exceptions. We have to look at the average. What is the time course? We don't know. Some people get better in weeks. Some people don't get better for even longer periods. It can last months. So the take-home message is a lot of things we don't know. What we do know is some of the drugs that are used have a modest effect. There is no perfect medication. Otherwise, we would be able to prevent patients from ever reaching this stage. We know drugs like steroids help because steroids suppress inflammation, and stage 3 is an inflammatory state. So they're helpful. Are they perfect? No. Do we know exactly what patients should get it and when they should get it? No, this is all evolving information. So we don't know. There are also other medications that you may hear about in the news. Some of them are helpful. The latest trials show some of them may be helpful, but none of them are perfect. None of them can be used in every person, and we're going to say that they have a good response. So what's the take-home message in the conclusion? A lot we don't know, but we do know the following. Most patients that get this disease recover. Some people recover in stage 1, and they may not even know they have the disease. Some people get stage 2 and often don't even need to be in the hospital, and they often recover. And then we have stage 3, the inflammation and the thrombogenic state. And once patients reach this stage, it's a serious problem. Often these patients are treated in the ICU, and they often have a rocky course, even if they do recover. So with that, I think I've covered most of the information we presently know in the cardiac world regarding COVID-19. I'll be more than happy to address questions regarding this.
Thank you, Dr. Cohen, for that very thorough presentation. It doesn't look like we have any questions at this time. I think because you answered a lot of your questions within your presentation. So we had a great attendance today. I'd like to thank everyone for coming. We hope to see you at the next one. And again, if you'd like to rewatch Dr. Cohen's seminar, we will be posting that to Facebook. So thank you again, and everyone have a great weekend. Thank you, Dr. Cohen.